to care for the ill. We have companies that are on the cusp of delivering vaccines. And most of all, we are blessed with generous and compassionate people all across America who are stepping up to help those who are struggling. If we work together, we will overcome this pandemic and our lives. But COVID-19 is not the only health crisis we face. If anything, it has underscored a host of other epidemics that are devastating families and shortening lifespans. Crises like addiction, including the opioid crisis, our aspiring mental health concerns, our glaring racial health disparities, and the high rate of chronic illness that we face, like diabetes and heart disease. These challenges are both caused by, but also exacerbated by, broader societal issues, from the economic strains so many people are facing, to the disconnection, loneliness that many of us feel. In a new expanded role, I will work to bring a health focus to our policies across government so that our schools, our workplaces, and our communities can be forces for health and well-being. But the truth is that the very best policies and even the best vaccines and treatments will heal our nation unless we also overcome the fear, anxiety, anger, and distrust that so many Americans are feeling right now. So more than anything, I will come to this role as a doctor, one who learned the most important lessons about medicine, not in medical school, but from the clinic that my parents opened when they first came to America as immigrants decades ago. As a child, I saw how they took their time, not just to diagnose illnesses, but to ask their patients' families about lives, to pore over pictures of children and children that were pulled from wallets. They listened deeply to people's stories and their struggles, often running well over their appointment time. And they taught me that the best doctor is not an authority figure who writes prescriptions, but rather a partner in healing. Someone who sees patients in their fullest humanity and empowers them to take charge of their health. That is the kind of doctor I have always tried to be. And if confirmed, that is the kind of Surgeon General that I will strive to be. I will dedicate myself to caring for every American, driven always by science and facts, by head and by heart, and endlessly grateful to serve one of the few countries in the world where the grandson of a poor farmer in India could be asked by the president-elect to look out for the health of an entire nation. That is a testament to the promise of America, one that I will seek to fulfill every day as Surgeon General. Thank you so much. And thank you again, Mr. President-elect and Madam Vice President-elect, for this opportunity to serve.
Thank you.
Mr. President-elect, Madam Vice President-elect, I am honored by the trust you have placed in me to serve the American people during this critical time. I want to thank my amazing husband and our 3 wonderful sons for answering this call along with me. As all doctors and public servants know, these jobs ask a great deal not only of us, but of our families. The pandemic that brought me here today is one that struck America and the world more than 30 years ago. Because my medical training happened to coincide with some of the most harrowing years of the HIV/AIDS crisis. As a medical student, I saw firsthand how the virus ravaged bodies and communities. Inside the hospital, I witnessed people lose strength and hope. While outside the hospital, I witnessed those same patients, mostly gay men and members of vulnerable communities, be stigmatized and marginalized by their nation and many of its leaders. A scientific breakthrough came in 1995 when the FDA approved the first AIDS cocktail, and we saw the first glimmers of hope. I've dedicated my career ever since to researching and treating infectious diseases and to end the HIV/AIDS crisis for good. Now, a new virus is ravaging us. It's striking hardest once again at the most vulnerable, the marginalized, the underserved. Nearly 15 million Americans have been infected. Over 280 million loved ones are gone. The pain is accelerating. Our defenses have worn down. We are losing life and hope at an alarming rate. I never anticipated I would take on a role helping lead our national response. Government service was never part of my plan. But every doctor knows that when a patient is coding, your plans don't matter. You answer the code. And when the nation is coding, if you are called to serve, you serve. You run to take care of people, to stop the bleeding, to stabilize, to give them hope and a fighting chance to come back stronger. That's what doctors do. I'm honored to work with an administration that understands that leading science is the only way to deliver breakthroughs, to deliver hope, and to bring our nation back to full. To the American people and to each and every one of you at the CDC, I promise to work with you to harness the power of American science, to fight this virus and prevent unnecessary illness and deaths so that we can all get back to our lives. Mr. President-elect, Madam Vice President-elect, I thank you for this opportunity.
Thank you, Dr.
Mr. President-elect, Madam Vice President-elect, thank you so much for this opportunity to serve the American people. I'm proud to go to work with leaders who are deeply committed to science and to centering equity in our response to this pandemic, and not as a secondary concern, not as a box to check, but as a shared value, woven into all of the work that we do and prioritized by every member of the Biden-Harris team. I'm enormously thankful to my team and to my colleagues, to President Salovey and the other leadership at Yale for supporting me in this work. And I'm grateful to all of the researchers and advocates who've blazed the trail, whose work on health equity and racial justice too often went unbelieved or overlooked across the generations. Most of all, I'm thankful to my family, to Jesse and our 3 children for their unwavering support and humor, and to my mother and her mother for modeling kindness, generosity, and courageous leadership through service. I've wanted to be a doctor since I was 6 years old, and I'm a proud general internal medicine physician today. But as I grew up, I came to understand that there were deeper dimensions to health beyond what I saw in the human biology textbooks that I borrowed from my mother's bookshelf. I grew up on St. Thomas in the US Virgin Islands, a place where people too often died too young from preventable conditions. My own father had his first stroke in his 40s and was left paralyzed. I learned there was a term for an underserved community, marginalized by place and by race. In my medical training, I saw countless patients whose conditions were shaped by factors having nothing to do with science and everything to do with broader social inequity. And now the COVID-19 crisis has laid those inequities bare. It is not a coincidence, and it is not a matter of genetics, that more than 70% of African Americans and more than 60% of Latinx Americans personally know someone who has been hospitalized from COVID-19. The same disparities ingrained in our economy, our housing system, our food system, our justice system, and so many other areas of our society have conspired in this moment to create a grief gap that we cannot ignore. It is our societal obligation to ensure equitable access to testing, treatments, and vaccines, equitable support for those who are hurting, and equitable pathways to opportunity as we emerge from this crisis and rebuild, including those most marginalized communities, the undocumented, the incarcerated, the homeless. I'm grateful for this chance to continue this work, to earn trust and to find success through genuine partnerships with the people and communities who've been hit the hardest during and before the crisis. On this team, you will be heard, you will be counted, and you will be valued. Thank you.
President Biden and Vice President-elect Harris, thank you so much for asking me to be part of the response. I hope that you sending this video is because Dr. Harvey Alter is receiving the Nobel Prize in Medicine at the same time, and we wanted to attend the ceremony at the NIH to show our support. Such an achievement is a reminder of the incredible public servants we have at the NIH and of America's place as a pioneer in science medicine. I believe, as you do, that in the fight against this pandemic, we must lead with science, and that a key piece of our ongoing work is communicating consistently with the people. Whether it's maintaining social distancing and not congregating indoors, or the 100-day challenge you described on masking, or to people vaccinated as possible. These actions are bold, but they are doable and essential to help the public avoid unnecessary risks, to help us save lives, reopen schools and businesses, and to eventually beat the pandemic. I look forward to advising you on these most urgent priorities and to work with this team of world-class experts I have known for many years and deeply respect. I have been through many public health crises before, but this is the toughest one we have ever faced as a nation. The road ahead will not be easy. We have got a lot of hard and demanding work to do in the next year. But as we have done during previous crises, I also know we can get through this pandemic together as a nation. Thank you for giving me the opportunity to be part of this effort.
President-elect Biden and Vice President-elect Harris, I'm honored by your trust in me and humbled by the task at hand. And I am hopeful because of your leadership. As it is for both of you, everything starts with family for me. And I'm forever grateful for the love and support of my wife, our children, and our parents. Mr. President-elect, we've known each other for a long time, and our relationship has been forged under immense pressure. the severity of the Great Recession, the challenge of implementing the Affordable Care Act, and the daily decisions that affect the lives of millions of Americans. You and President Obama build a team with the right diversity of backgrounds and views, a team to focus on difficult situations and capture enormous opportunities. That's what I've tried to do throughout my career. We're a public health expert. In fact, we've got the best ones in the world on this team. But I do know management and execution. And the key part of the role you've asked me to take on is the last part, coordinator. It's about empowering experts, developing a culture of teamwork, and maintaining a focus on strategy and execution. It's knowing that leadership requires expertise, transparency, and prioritization. It also requires trust, truth, and integrity. To the American people, that's what we'll provide. We will utilize the full capacity of the federal government to get this pandemic under control. To harness and examine the data to expand testing, to deliver equipment and PPE to those on the front lines, to provide resources for schools and businesses to operate safely, to address the racial disparities and inequities of this pandemic, to rejoin the global fight against COVID-19, because no one is safe until everyone is safe. And with our collective expertise, we will oversee the rollout of the vaccine, which, as the President-elect said, will be one of the greatest operational challenges our country has ever faced. And we also will pull the country together across governments at the federal, state, and local levels, and across the private sector. And as we begin this work, Mr. President-elect, I remember what you told me when we were implementing the Affordable Care Act. Your message was, I know this is no small task. I know you and the team are feeling tremendous pressure to succeed, and we want and need the team to pull this off. Then said, I know you and the team can do this, but I need to promise me one thing, that you will always, always give it to us, because we have to understand the challenge we're facing. Because most of all, we're in this together, and together we can do this. President-elect, Vice President-elect Harris, and the American people, this team will always give it to you straight. The work ahead will not be easy, but we know what needs to be done, and we will get it done together. Thank you.
Well, congratulations, Mr. President-elect, on nominating and appointing a most outstanding team to get this pandemic under control. And thank you to these accomplished physicians and experts and public servants for answering the call to serve the American people in this critical hour of need. Over Thanksgiving, the President-elect and I called healthcare workers who are on the front lines of this pandemic, just to thank them. We wanted to express our gratitude and our nation's gratitude for everything they have been doing, for every sacrifice they have made. That day, I spoke with 2 registered nurses, Maureen in Pennsylvania and Talisa in Illinois. They shared stories we've all heard. We've all heard the stories about grandmothers and grandfathers, loved ones, friends spending their last moments alone. We've all heard about nurses and physicians who are physically and mentally exhausted, trying to keep up with ever caseloads. Those on the front line who say to each other, it's not a matter of when, right? Or it's a matter not of when, but when they will get the virus. So it is a matter of when and not if they get the virus. This is what they're saying to each other every day. We've all healthcare workers without the supplies and equipment they need to care for patients and save lives. So today, we have a message for Talisa, Maureen, and all Americans. Help is on the way, and it is long overdue. The scale of this pandemic is heartbreaking. As you know and have heard, almost 15 million cases, more than 2,800 deaths in a single day. And then there is the economic devastation, the lost jobs, the small businesses shuttered, not to mention what's happening to our schools, the parents and teachers stretched to their limits, and the toll it's taking on the mental health and well-being of our children who risk each day falling behind. Opening our schools and economy safely and responsibly, getting this virus under control, all it starts with listening to experts and leaders like these, Americans who reflect the very best of our nation. They are top physicians, public health experts, and public servants. And they are the that the American people need and deserve to make sure testing and treatment are free for everyone, to make sure vaccines are safe, free, and distributed, to make sure we are better prepared for future pandemics and other health threats, and to make sure quality, affordable health care to all. From an early age, I saw the life-saving work that our healthcare professionals provide, especially for the most vulnerable among us. You see, my mother was a breast cancer researcher, and my sister and I spent many hours roaming the hallways of the hospital where she worked. I'm sure your kids have too. And it's why I actually later co-founded an auxiliary group to help patients at the county hospital in Oakland, California, more than 20 years ago. It's why we need to protect and expand the Affordable Care Act. And it's why we have to listen to frontline healthcare workers like Maureen and Talisa. In fact, during our conversation, Talisa said, we wouldn't send our soldiers to battle without the gear they need. And we shouldn't then send our doctors and our nurses to fight this pandemic without the gear they need. And of course, she's right. And President-elect Biden and I, along with this world-class team, will make sure we are doing everything we can to save lives and contain this pandemic once and for all. Getting this virus under control is one of the defining challenges of our time. And we will do what the American people have always done in the face of a great challenge. We will stand together and we defeat it. Thank you.
Thank you, President.